Irmagard Bartenieff had a thing called heel rock. So you're going to kind of push and pull with your feet, and you're going to let your pelvis undulate. So it's like I call jiggle therapy. And here's a great chance to observe is if I lock one piece of my spine down, it's not going to go through, undulate through that. So that's a very basic heel rock. You straighten your legs down, and you kind of go into a little dorsiflexion. You can do another heel rock. This should be very gentle. And then just bend your knees, and then just observe where you are. Open your arms out to the sides. You have 8 counts to slowly sway your right knee to the right. Your left foot is flat. Your arms are out by shoulder height. Just be there. You're going to observe, oh, some tightness in my inner thigh. And notice it's starting to gently rotate your pelvis to the right. And it's starting to wag your tail to the right as well. And now slowly sway the left knee to the right. And your left hip is going to come off the floor. And you're going to feel some of the tissues around your hips. You're going to have a different experience from left and right. And you're going to notice, oh, how's my hip? So now softly turn your head to the right. So you're bringing your whole spine into a C curve. And now place your left foot right on top of your right knee, ankle, and then reach your left knee a little past your right knee. So you're getting a little more rotation. And you're just going to breathe through that. So now notice it's making your spine go into a little deeper C curve. You have 8 counts to bring your pelvis back flat on the floor. You have 8 counts to sway your left leg to the left. Notice in the simplicity of that, you're starting to rotate your pelvis to the left. And then you're not going to do anything. You're going to gently turn your head to the left. So now you're noticing it's starting to side bend your upper thoracic to bend to the left. You're going to sway your right knee to the left. And you're just going to breathe through that. And notice though this side might be a different experience than the other side. And then you're going to place both feet on your right foot on top of your left ankle, and you're going to reach your right knee a little longer past your left knee, and you will roll a little more to your side. And then I just want you to breathe. And is there a place in your spine that's not going into that lovely lateral flexion? And you're just going to breathe through that. And now you're going to shift your pelvis back center, 8 count. Right leg, 8 count. Gently turn your head to the right. Do not push. Okay. Are your shoulders tensing? Can you let it go? Sway your left leg to the right. Your pelvis is going to rotate even more to the right. You're just going to breathe through that. You're going to place your left foot on top of your right ankle, and then you try to bring your knees maybe more together. Your pelvis will rotate a little more right. You're just going to breathe through that. And now you have 8 counts to bring your feet back flat. And you bring it back. You're going to do a knee sway to the left, 8 count. You're going to gently turn your head to the left without lifting your head up, and you're not going to push. Notice you're going into a C curve. You're going to gently sway your right knee to the left, and your pelvis is going to rotate more to the right. And then you're going to place your foot on top of your left ankle, and you're going to try to bring your knees together. It's not totally possible. And notice it's increasing that lateral flexion and a little rotation. And you have 8 counts to bring it back. One more set. Knee sway, right leg, 8 counts to the right. Turn your head to the right. Sway your left knee to the right. Place your left foot on top of your right ankle. Now take your left arm and reach along the floor towards your left ear and reach to the right. So now your whole left side of your spine is elongating. And then can you relax your shoulders? You're going to open your arm back out to the side. You're going to put your feet flat on the floor, and you're going to bring the whole thing back center. You're going to sway your left leg to the left, 8 count. You're going to sway the right knee to the left. And then you're going to place your ankle on top of that, and you're going to get a gentle rotation. You turn your head left, and then take your right arm, roll along the floor towards your right ear, and reach your right arm more to the left, and feel how you're elongating the whole left side of your body. Open your arm out to the side, and you're going to sway your knees back to center. And you're going to have your feet about 1 foot away from the wall. And then, so you're going to face profile so that you can lean your hip against the wall. Now you have a choice. Your arm could be, if you're really tight, it could be in front of you. Your goal is to go here, but if there's a lot of tightness, that's really difficult. And you're going to lean your hip into the wall, and you're going to stretch that whole side up. So walk your feet away from the wall. So if I'm too close to the wall, I'm not going to get a stretch. So you want to have about 1 foot away from the wall. Walk your feet more away, Betsy. To the right, to the left. Great. Now, you're going to move your hip away from the wall. And then you're going to bring it back. Another version of side flexion. And so one reason I'm teaching this is especially with clients that are traveling and it's not comfortable to be on a floor, they could do it against a door or a wall. Then you're going to take your arm that's on the wall, you're going to stretch it higher up the wall, and then you're going to bring your arm closer to your ear. So your whole body is side bent. And then you're going to come back up, and you're going to turn around and face the other direction, or whatever you have. So I'm about 1 foot or 1.5 feet away from the wall. Walk your feet more away from the wall, Betsy. And then lay your hip on the wall. And how much can you stretch that arm that's on the wall to open those ribs? So you're going to move your hip away from the wall, and then you're going to bring the whole thing back. And you're going to move your hip away from the wall, and then you're going to bring it back. And you try to keep your ribs against the wall, so it's going to force that S curve. Great. Now slide your arm again that's on the wall, up the wall, and then you're going to side bend and try to bring that arm closer to your ear. And then you're going to come back up and through. Now come sitting on a chair. You could do this standing, but I first, especially for some of my clients, I want you to discover how much you can get your upper body moving compared to your lower body. So you're going to put your hands behind your back, and it depends on the tightness in your shoulders. Some of you might be able to do this. I can't, so I'm more comfortable grabbing my hand. So you're going to I would face a little towards the, turn the chair, Betsy. So you're going to squeeze your shoulder blades together. That's retraction. You're going to lift your breastbone up towards the ceiling. Then you're going to softly let the shoulder blades go forward, which is protraction. And you can take a tiny, tiny bow. You're going to squeeze your shoulder blades together. No, you're vertical. You're up vertical. And you squeeze and you lift your breastbone up. You can softly look down because we're trying to get that upper thoracic moving and the shoulder blades moving. Then you're going to bow your shoulder blades forward. And it's a small bow, so I don't change my pelvis on the chair. I'm not leaning forward. Bring your elbows forward. And you're going to squeeze your shoulder blades together and lift. And then you're going to let it go. Now just release it a second and feel how your spine feels. Okay? Bring your right arm behind your back. So we're going to do a single arm. So I'm going to squeeze my shoulder blades towards my spine, and I'm going to let my ribs rotate to the right. Vertical is up spine. Do it slowly. I'm going to slowly, 8 counts, bring my right shoulder blade forward and take a small bow towards my left knee. 8 counts. Squeeze the shoulder blade. Gently turn for another 6 counts to the right. And then you're going to bow to the right, Betsy, that's left. And then you're going to go forward. And you're going to squeeze it back. So you're turning, you're looking over your right shoulder. And then you're going to bring it forward. And you're going to go. Release that down. Feel how the right side feels a little different from your left. Put your left hand behind your back. Left hand. You're going to squeeze your shoulder blade towards the spine, and you're going to gently turn to the left. And then you're going to bring that shoulder blade forward and bow softly to your right knee. Now it's sequential. It goes shoulder blade, squeezes the spine, ribs gently turn, then maybe my head turns. Shoulder blade leads to turn my spine right, and I bow towards my right knee. And then I'm going to squeeze and turn to the left, because I pull that shoulder blade back, and then I'm going to bring the whole, and then I'm going to bring it back. Now, some of you, what you do is when you start looking over your shoulder, you drop out of your arm. So push with your left arm to look over your right shoulder. Can you look at your foot? And then come back. And push. And can you look at your left foot? Maybe you can today. And then come back. Now do it slower. 4 counts to side bend, one direction. Hold it for 2 counts. 4 counts to come back. 4 counts to side bend, to the other direction, and then come back. Notice when you go slower, it's teaching you to get some better articulation in the spine. Now we're going to do a left knee frog, and the knee comes out to the side, like so. Don't keep, you're a baby, you don't want to flop, you have to push. Now notice your spine is side bending again. Lumbar, and then bring it back. And now you're going to do the other side. And then bring it back. And you're going to now look over your left shoulder so you look at your left knee. Push harder so your arms are firm. And then press and come back. So your clavicle's higher than your humerus bone. And now you're going to go to the other direction. And notice your spine is in a C curve or a crescent move.